The fascination with Ozempic in weight management circles has caught widespread attention with big names like Elon Musk, Oprah Winfrey, Kelly and Sharon Osbourne, all having spoken publicly about the weight loss wonders of Ozempic. Now, there are other products as well, and what it has done is to bring these medications into the limelight on social platforms and in the media in general. Now, globally, being overweight is a big health problem, and it's especially serious in South Africa. And here, according to the Global Obesity Observatory, half of South African adults are either overweight or obese. And of these, 23% are overweight and 27% obese. Now, to discuss this weight loss phenomenon further, we joined virtually by diabetes specialist with a Mediclinic, Dr. Marius Wasserfall. Dr. Wasserfall, thanks so much for your time and welcome to Morning Live.
Good morning. It's a pleasure to be with you.
So Ozempic has taken the world by storm, literally. And obviously, so many of us, have looked at this, but then come to the realization that this is essentially a drug that was on the market for the use of diabetics. But let's talk about Ozempic, Dr. Wasserfall. What is it and how is it generally used?
So Ozempic is actually what we call a GLP-1 receptor agonist, which means it is a substance that mimics the normal hormone GLP-1. So that hormone is crucially important in glucose metabolism, but it does have a role in gastric emptying as well as appetite regulation. And it is in this role of appetite regulation where people have noticed that they have significant weight loss because they do not feel as hungry. Their satiety hormones are increased, they are eating less, and for the one we are referring to, semaglutide or Ozempic in low doses, though it is primarily a diabetes drug, they have seen up to 15% of weight loss with the high dose of this drug. And as you correctly mentioned, there are other GLP-1 receptor agonists. Liraglutide, for example, gives about a 10% weight loss. And the new kid on the block, which is coming soon, is called tirzepatide or Mounjaro. And there we are looking at 22% weight loss in a third of people at the very high dose. But as you correctly state, this is primarily a diabetes drug because it does increase insulin secretion and decrease glucagon secretion. But the weight loss effect has caught widespread attention across the globe.
So to that point, after, you had all of these celebrities talking about this wonder weight loss drug, many more people wanted to gain access to it, Dr. Wasserfall, here in South Africa as well. But it begs the question then about the safety of people using Ozempic, especially people who do not suffer from diabetes.
Yes, I think the stats that you mentioned about obesity and people that are very desperate to lose weight and how the difficulty of losing weight without using adjunctive medication has pushed a lot of people to try and use the drug for that indication. But remember that most medications are tested for a certain amount of time. We only have 3-year data on most of the GLP-1s from a safety point of view. And we do not know what happens over 5, 10, 15, or 20 years. So that is one of the big concerns and things that's being monitored very closely. So the current indications for this medication is if you are severely obese, which means a body mass index above 30, or if your body mass index is 27 to 28 and you do have comorbidities like diabetes. And then it's got a very, very big role to play in diabetics with complications, specifically cardiovascular complications and some renal complications. So I think we should stick to the current guidelines for use. And people need to remember that, yes, this helps on appetite regulation. But the moment you stop this drug, your appetite regulation goes back to what it was before, and there's a massive weight regain. So these are long-term drugs. It's not a drug you can use for 6 months or 12 months to give you a kickstart and then you stop. You have to be prepared to stay on this drug lifelong.
Phew. And, of course, as you said, Dr. Wasserfall, only 3 years worth of data is currently available because one of the other issues that one wonders about is, of course, the side effects and, what has been reported so far in that regard.
Yes, so the follow-up safety data seems to be reassuring over 3 years. What we see practically and what's been described is that there's a lot of gastrointestinal side effects. About 20% of people have got significant nausea as well as diarrhea, to the extent where about 16% of people cannot tolerate the drug and they actually discontinue. As with all medication, there's always a risk of hypersensitivity and allergic reactions. So that is very, very seldomly seen with the GLP-1 receptor agonists. And then the more serious side effects, where one can have acute inflammation of the pancreas, which can actually cause you to end up in hospital. You can have reflux, you can have headaches, you can have fatigue. And there's been some instances of gallbladder disease with gallstones and acute inflammation of the gallbladder as well. So this remains a drug that needs to be used within the parameters of safety and indications, and not off-label use because there are safety risks.
So would it be advisable then, let me start at this point rather, in terms of whether people who want to use this for weight loss are actually able to access Ozempic or any of the other alternatives that you've mentioned, Dr. Wasserfall?
Yes, there are. There was a problem because of the incredible demand for this drug. The amount of people that are overweight that's trying to access it is incredible. So the companies were struggling to stay ahead on supply. However, in South Africa, that has been sorted out, and there is enough supply of Ozempic at this stage. But remember, Ozempic is the low-dose formulation, which is actually a diabetes drug. The higher dose formulation is called Wegovy. That's still coming. That's the actual weight loss one. So it is available. It is a Schedule 4 drug, which means you do need a prescription. But please, you do not need to try and access black market compounds or other compounds. There is Ozempic available in this country, and there is enough.
So Wegovy, as you say, for that, will people need a prescription as well?
Yes, for all these drugs, it's Schedule 4. You do need a prescription. You cannot just buy it off the internet. You do need to speak to your doctor, because remember, we monitor these patients. We first assess whether they are candidates, whether they are safe, and then we reevaluate every 2-3 months to monitor for side effect profiles, potential risks that could lead to complications, etc. It has to be monitored, and yes, it is a prescription drug only.
And then for people who perhaps would not be able to afford to go and see a doctor and get a prescription, but of course are desperate to lose weight, Dr. Wasserfall, what sort of interventions do you think could be had there once you do have Wegovy and others available?
No, I think you need to remember that these drugs have got risks. So if your question is whether people that are struggling to go and see a doctor should try and utilize this and access it on the internet, on the black market, the absolute answer is no. There are risks involved, and there has been incidents across the world where people buying this drug on the black market and from compound pharmacies, they do not know what is in that. It is not regulated, and there's been an FDA as well as a SABC in South Africa warnings sent out for the illicit use of these drugs that are bought on the internet and on black markets because of the health risks associated. So we still remember, this drug by itself is much more expensive than a doctor's visit. And that is where the one big limitation comes in, that people need to be willing to pay 1,500 to 2,000 rand a month long term to be on this drug. So seeing your doctor is the cheaper part of that, and having a discussion about safety and about the future is definitely in your health interest, rather than trying to buy this drug and not knowing what you are getting off the internet or from the black market.
So just out of interest, Dr. Wasserfall, is this something, as you said, especially with Wegovy on the way, would that be something that doctors would prescribe for weight loss to their patients?
Yes, definitely. The GLP-1 receptor agonists are one of 3 medications currently on the South African guidelines for weight loss, but it's probably the only one with a longer-term data. So it is definitely a drug that can be used. The current preparations, however, are being used off-label, even by doctors, because we know there is some weight loss that you can have with a lower dose semaglutide, which is called Ozempic. And currently Ozempic is about a 0.25, 0.5, and 1 milligram dose. But the real weight loss dose is 2.4 milligrams, that is Wegovy. But the most prescribed dose internationally is the 0.5 milligrams. But remember, the true weight loss dose is 2.4, which will get you to, let's say, about the 15% weight loss.
And how long before we see Wegovy in South Africa?
That is a good question. I think we're probably going to see Mounjaro before that. That is tirzepatide. That is the one where in a third of people, they got to 22% weight loss. And we're probably going to see that, if not by end of this year, then very, very early in next year.
Dr. Wasserfall, it's been a very, very instructive. Thank you so much for your time this morning. Diabetes specialist with Mediclinic, Dr. Marius Wasserfall, speaking to us about Ozempic and other medications within the weight management circles, and what are some of the pros and the cons that go with this.